Hi, everyone. Lisa with IVF Manifesting a Miracle, and I'm here with our friend Dr. Greene today for another clinical conversation. How's it going, Dr. Greene?
Fantastic. How you doing today?
I'm doing well. Today we're recording this for St. Patrick's Day. We both got our green on, and as you said, you got green every day.
Every day, every day. And despite what Kermit the Frog said, it is easy being green.
I love it. Okay, so with this being Endometriosis Month, March, we decided to do a talk about this topic, endometriosis. And can you first maybe start off by telling us what exactly is endometriosis?
Yeah, endometriosis is basically a condition that was first described based on what we would see during surgery. You know, at the time of surgery, we would often see these lesions at different places, most commonly in a woman's pelvis, on the inside. This is during surgery. And when you would do a biopsy of these lesions and send it to the pathologist, it would say endometrium, meaning it looks like it's from the lining of the uterus. And we would say, but wait, I took this biopsy on the outside of the uterus or on the intestine or the inside of the pelvis. So we knew it wasn't endometrium, meaning that lining that normally gets shed and comes out with the menstrual flow. And so that's where this diagnosis came from, because it's the same type of tissue that lines the uterus and grows and sheds each month, but it's in the wrong place. So it's different from something that's a cancer where it's growing out of control. This is growing and shedding as if it was in the right place, but it isn't. And the problem is anywhere it lands, it can create symptoms, it can create scar tissue, it could create inflammation and other things that we're still learning that could disrupt fertility or cause pain or cause both.
Okay, so it's kind of just this inflammatory tissue, really?
Well, like I said, it's technically it's the normal tissue, but it's in the wrong place, which is what causes it to be inflamed. Just like think about if the sensitive skin inside the palms of your hands were on the soles of your feet, you wouldn't be able to walk, Okay. And so again, sometimes the right tissue in the wrong place can cause symptoms and problems.
How common is this, if you can answer that?
Yeah, I don't think anybody could answer that, Lisa, because like I said, this is something that we used to diagnose based on surgeries, and we used to do a lot more surgeries. Now that we know that endometriosis is around, we have other ways of treating it. If someone wants to get pregnant, we try to help them get pregnant, which often treats the endometriosis. If they're having pain, we have ways of treating the pain without doing surgery. So we're doing far less surgery today. But if you go based on symptoms, it's estimated that at least about 10% of women are affected. But if you're looking at people that have fertility issues, it's estimated to be more about up to 1/3.
Wow.
And if you're looking at people that, for instance, have that diagnosis that we've talked about recently of unspecified infertility, if they haven't had any surgery, it's even estimated to be higher in that patient population. And that's why we used to do so much surgery, was to answer, was this causing the problem? But as we talked last week, we came to realize we were doing a lot of surgeries, but then still offering the same treatment path. So now we try to skip surgery and say, oh, this might be endometriosis. Let's just treat it presumptively, assume there's endometriosis, and let's focus on the goal. Are we going to try to achieve a pregnancy? And if so, how are we going to do it? Or are we going to try to relieve pain? And if so, what are some reasonable ways to do it?
So to rule it out during IVF?
The only way to rule it out is to do surgery.
Okay.
In other words, you have to look in all the places where it usually hangs out. And the only way you could see that is by doing a laparoscopy or a bigger surgery and look, because we find that some people actually can have really significant endometriosis when you look and yet have no symptoms.
Yeah.
And we find there are some people that have really bad symptoms and have very little or no endometriosis. So there's not a clear correlation between how much we see and the symptoms someone experiences.
Mhm. Yeah, I know in our situation, we had a lot of setbacks before our transfer. And one of the last surgeries I had was a fibroid surgery.
Mhm.
And the doctor had found some endometriosis in that
Oh,
surgery.
by the way, right? It's
Found some
because
of
you're
that. I
there
didn't even know
doing
I had it.
surgery.
Yeah, I didn't even know I had it. So that could have
Yeah,
been
and that's not uncommon. It does not always cause symptoms.
right.
And in some people, I mean, there have even been some studies that show that sometimes when you see the most extensive endometriosis, you talk to the patient and she's like, yeah, I don't really get cramps, and so there's not a clear correlation. And that's part of why this has been such an enigma and a bit of a challenge to both diagnose and treat.
Okay. One of the questions that came in is, would you approach IVF stimulation differently with an endometriosis diagnosis?
Yeah, I would, in the sense that sometimes there's an imaging study that might show endometriosis, like particularly if a woman has endometriosis within the ovary. That's
Mm-hmm.
a specific location that actually is so important it has a special name. That's called an endometrioma.
Okay.
Okay. Endometriosis in the ovary is called an endometrioma. And the reason that that's significant is we're learning more and more about how endometriosis affects egg quality. Okay.
Mm-hmm.
Specifically, there have been studies that show, for instance, if a woman has an endometrioma on one side, not on the other side, you will often get fewer eggs and lower quality from the side that has the endometrioma.
Can you repeat that one more time?
Yeah, that if you have the same woman and you know
Mhm.
that she's got endometrioma or endometriosis in one ovary, not in the other ovary, studies show you'll often get more eggs from the side that does not have it, and also get higher fertilization rates and higher embryo quality from the side that doesn't have it. That doesn't mean you're not going to get any from the other side, but
Mm-hmm.
it clearly, it clearly shows that where it's at tends to be where it causes the biggest problems, because within the same woman, literally the distance of a few centimeters can make a big difference in how one ovary responds compared to the other. And so when I see those situations, I just try to have, first of all, help, the patient mentally understand why, that they might get fewer eggs or embryos on the one side, because creating realistic expectations is one of the most important things a responsible fertility specialist does. You don't want to give false hope, but you also don't want to be overly negative. You got to balance that very carefully. And so, the other thing too is there are different ways that I tweak the protocol in order to optimize our ability to overcome endometriosis.
Wow.
And we don't all share the exact same recommendations. I'm happy to share with you some of mine, but I want to be clear
Yeah.
that part of the reason that success rates vary and treatment plans vary is that we don't all agree, because there's not one perfect truth that answers everything today.
No, I appreciate that. And you're really up on top of the science and the latest data and research. So I'm sure you bring that.
Well, and what I do personally, Lisa, is I'm always reading the latest research. I'm always asking my colleagues and peers, both in my group and elsewhere,
Okay.
what the way they do things. And then I integrate that into my own experience, and then I counsel the patients and I adjust things accordingly.
Mm-hmm. One of the questions back to the endometrioma you mentioned, and a question a woman sent in to me was, is it safe to have an endometrioma during pregnancy?
Yes, and in fact, you will often find that the endometrioma may be substantially less or even resolve completely by the time the pregnancy is over. The
Wow.
one exception is if it's an unusually large endometrioma. So in other words, size does matter in this.
Okay. So you could have endometriosis again. You said ovaries, around the uterus, in the uterus.
Yeah. And there's even been reported cases of it traveling to far distant shores within the body. Those are rare cases, and they usually are written up in medical journals, but they've been confirmed. Like, for instance, there are some women that literally can sometimes cough up blood during their menstrual cycle because they could have endometriosis in their lungs.
Wow.
There have been recorded cases of people that could actually have, what looked like, bloody tears because, they could get endometriosis in the lacrimal duct in the eyes. So there have been rare cases of it traveling way beyond the pelvis, but those are unusual exceptions, and we don't really know exactly how or when that happens in a woman's life. Typically, it's local within the pelvis.
Okay. And I know you've been practicing, what, 20, 25, how many years have you been
25 years. You
25 years?
always age me.
No. But I'm curious.
It's a lot of years, a lot of experience.
Well, we need doctors like you with the experience for sure. But I'm curious, just in your personal experience, have you seen an influx or an increase in this condition in women?
Well, we do see it more, and we believe that that's probably due to a couple of different things. One, we're looking for it more, okay? And like anything, if you've got a heightened awareness, you tend to see it more. There's pretty significant data that certain of the hormone disrupting chemicals that we tell people to avoid can increase the risk of it. Certain things like PCBs and dioxins, you hear about these things sometimes being found as water pollutants, and you find a cluster of higher number of cases. But it's even been shown that in certain animal models, they've actually been able to induce endometriosis by exposing animals to some of these chemicals. So, we do believe there's a correlation, and this is why we tell people that it really is important to, avoid your exposure to these things as much as possible, because we do believe that some of the increased awareness of endometriosis is due to looking for it, but some of it is probably due to some of these chemicals that are in the environment that, we're exposed to, sometimes in a regional fashion, and sometimes more related to our own, habits or the things that we're doing.
Can you list a couple simple things that people can do? I mean, like switching out plastic, not using, what would you suggest, or do you suggest to patients?
Well, I mean, a whole bunch of different things, being very cognizant of plastics. You could actually find out, for instance, from your local water company, they're required to report the purity of their results on a regular basis, and so you could check with your own water company and see how your own water has been tested, and how well it's passed. Because a lot of people, for instance, will buy very expensive bottled water, but if that bottled water is stored in the wrong type of plastics and then in a hot warehouse and in a hot truck, some of these chemicals will get from the plastic, that's used in the container into the water.
Oh, gosh.
Things like microwaving your food in plastic containers, that causes a certain number of these chemicals to leak out of the plastic so that it's in your meal when you eat the meal. So when you microwave things, you should microwave on like ceramic plates or glass or things like that.
Okay.
Find a glass water bottle. I could tell you, for instance, I've got my metal coffee mug, and again, there's a reason that these things do matter. Plastics, have a lot of different, chemicals added to them. And some of these chemicals are added to make the plastic more flexible or more shiny. Some of these things are related to fragrances. Believe it or not, certain chemicals are added to like scented laundry detergents or dishwasher detergent so that things have that fresh smell longer, and so sticking with unscented products can dramatically reduce your exposure to some of these types of chemicals.
Really good tips. Thank you. And another question that was sent in, what are some supplements that you would recommend an individual take for endometriosis?
Well, and this is one of my favorites, and I know you're often very kind about giving a link to my blog. There's a lot of recommendations out there that don't have any data or great data, or sometimes no data. There is one supplement that, and part of the problem is there's no one that usually spends a lot of money on supplements to do research. But there's one supplement that it's an extract from the maritime pine. Okay, it's from the bark of a maritime pine tree, and it's a supplement called pycnogenol. That's spelled Pycnogenol, pycnogenol, that has been shown to not only reduce pain in women that have endometriosis related pain, but it's also been associated with a higher pregnancy rate in women that are taking it and not on contraception.
Wow.
And ironically, this was shown in one well-designed study that I highlight on my blog. It was shown to be as effective as a very expensive drug called Depo-Lupron that's used to treat pain. And it doesn't have any of the side effects that Depo-Lupron does. Depo-Lupron causes a temporary menopause so that people get hot flashes and night sweats in order to try to reduce the pain. But the studies show that this pycnogenol doesn't have any symptoms, and yet it can dramatically reduce the pain. And this has been shown in patients that both have confirmed endometriosis based on surgeries, or people that just have symptoms of endometriosis like pain. It's interesting because I could tell you when I first started in the group where I'm at, I'm almost 6 years in my current location. When I first started recommending it, all the nurses that I work with were skeptical. And they're like, oh, what does Greene know about menstrual pain? You know, he's talking about his crazy pine bark, you know. Now I can tell you most of them are actually taking it themselves.
Really?
And I could tell you, Lisa, and I mean this, I've had patients that literally had such bad pain every month that they were considering a hysterectomy, have gone on this supplement and had such profound reduction in their pain that they're talking about, okay, what can I do now to help me get pregnant?
Oh my gosh. Well, you're sharing some major pieces of wisdom here.
Well, and like I said, it's not something I'm selling. So, I have nothing to gain if someone doesn't want to try it, but and it doesn't work for everybody, and it does take time. It's not the type of thing that someone, takes when they have a headache, and it works within 2 hours. You literally take it every day. And over the course of weeks, I always tell people, if you take it for 3 months and you don't notice any benefit, it's probably not going to help you. But what I tell people to do is, if you're going to try this, at the time you start it, write down, preferably even before you start it, write down on a scale of 1 to 10 how bad your pain is. And then track it over 2 to 3 months. You'll be shocked if it doesn't go down.
2 to 3 months. Okay. Yeah. Wow. And where can you buy this? Is it kind of...
You can buy it online. You can buy it at wherever you get your supplements. You can get it at the supermarket. You can get it at a supplement store. You can get it online. I'm not selling it.
No, I know you're not. Yes, consult with your own physicians and take everything. Yes, we're giving information, but not.
Yeah, but again, it's not something that requires a prescription. It's a supplement.
Supplement. Okay. And can it do any harm? Really?
Well, like anything, it is possible that someone could have an allergic reaction, just like you could have an allergic reaction to any supplement. Right. But, aside from that, as long as the manufacturer is producing a good product, it shouldn't cause any harm. It just might not create any benefit.
Spell it and say it one more time for us.
Pycnogenol, Pycnogenol, pycnogenol.
That's wonderful. Thank you.
Or you could Google pine bark extract and it'll come up.
Wow. And you learned.
And I know it sounds strange, but I remind people all the time that aspirin is an extract from willow bark. There's a chemotherapy called Taxol that's an extract of a different pine tree bark. Opiate, morphine comes from opium flowers, or poppies. So there's a lot, digitalis, which is a heart drug, comes from a flower. So there's a lot of very potent medicines that come from nature. This is not unusual.
Okay. Hold on 1 second. Okay, we're back. I had to plug in my computer before it died. One of the questions I'd love to hear your response to is it a good idea to treat endometriosis before starting IVF?
Yeah, and again, this is something that we've learned from experience, and attitudes have changed. And my recommendation, unless somebody has severe pain that they can't live with, is that there's no benefit to treating it before IVF, and there is potential harm. We've
Really?
talked about taking a goal-oriented approach.
Hmm.
Studies show that doing surgery for endometriosis is usually either not going to create a benefit or possibly going to damage the ovaries, so that you're going to get fewer eggs and have lower quality eggs. So surgery is not recommended. Plus, there's a delay. If you do surgery, you got to schedule, you got to recover. The other way of treating endometriosis before IVF is with medication. But the medication is something you have to take for 3 to 6 months. So again, there's a loss of time. And studies show that there might be a slight benefit afterwards in terms of the pregnancy rates. But other studies have also shown that you also tend to require more medication and have fewer mature eggs after treating, so that the ovaries seem to be a little bit more resistant after being put through like the 3 to 6 month treatment. So again, you're wasting time. And at the same time, it seems like you might be lowering your response. So to me, it's a zero-sum gain unless you're doing it to try to control the pain before you go to actually do IVF or something to treat to become pregnant.
Thank you for explaining that. Some of the newer research, you shared a little bit with me, how endometriosis can impact egg quality. Could you share a bit on that?
Yeah, and again, it's been fascinating. This is looked at as you and I talk about on a weekly basis. There's so many factors that are factored into each patient, that each patient is unique. So it's not an easy thing to study because each person also has a partner, and there's so many other factors related to implantation. But like, for instance, studies show that women that have a history of endometriosis actually have the same pregnancy rates if they use an egg donor as people that don't have endometriosis. So again, if you get eggs from someone that did not have endometriosis, the pregnancy rates are much higher, even if you put them into someone that does have active endometriosis. Okay. So that's suggesting it's more of an egg related issue, because in those situations, you're still fertilizing the egg with the partner's sperm. So that variable is controlled. There have been other studies, as I mentioned earlier, that if someone has endometriosis that's confirmed in one ovary and not the other, tends to be higher pregnancy rates from the side that did not have the endometriosis. But that's only if you actually have other studies that show that when people donate embryos, if that person had endometriosis, you do see lower pregnancy rates, even if you transfer that embryo to someone that does not have endometriosis. So this has been looked at several different ways. All of the different research seems to agree, but I'm using the word seems to because it's still, there's still a possibility that there's exceptions to this, because like any disorder, endometriosis is one of these things on a spectrum. And I know that a lot of people are used to hearing about stage 1, stage 2, stage 3, stage 4. But another thing that I know you want to ask about is the cousin of endometriosis called adenomyosis.
I know, that was my next question. How are they related? What's the difference? Adenomyosis.
Yeah, well, I mentioned that endometriosis is like that surface layer inside the uterus. You could think of it as like the topsoil when you go to plant your crops, okay? Now, if that gets out of the pelvis, then you could see it. But sometimes that top layer, that topsoil, can get deep into the muscle where it's supposed to be just muscle and get trapped under there. And when that happens, that area where it's trapped inside the muscle is called adenomyosis. And the problem is that can cause the same inflammation that can damage the eggs, only it's creating that damage inside the muscle, which can make it so that someone has a lower chance of implantation.
And then treating that, you would recommend treating that first?
Yeah, and that is different from what I was saying a moment ago, because if someone has adenomyosis,
Right.
then treating that before doing an embryo transfer does improve pregnancy rates.
Okay.
But you should still complete the IVF portion and make the embryos first before you then treat the adenomyosis. So in other words, don't treat the uterus until you're ready to fill the uterus. The other way I tell people, don't paint the baby's room until you're getting close to your due date.
Yeah. Yeah. Wow, this has been a wonderful talk. You have so much great information to share. I think a lot of people are going to learn a lot from this one.
Well, and the point is that, you know, we're still learning. That's why success rates continue to get better. And I think it's important that we continue to translate what we're learning to the patients so that they could be involved in how we evolve and come up with better treatment plans that better meet patients' needs. So that's why I so appreciate you, you know, seeking out these questions and providing a venue to answer them so that anyone that wants the information has it available to them.
Well, thank you for doing them. I enjoy doing them. And can you believe, gosh, we've been a year now in COVID. We just had the 1 year anniversary of.
Yeah, one of these days we'll be able to record in the same room again.
Oh my gosh. I so appreciate all your wealth of information, and people can find your blog at enhancingfertility.com and reach out to you there. Is that right?
Absolutely. And you could also read some of the studies on pycnogenol there if you want as well.
Yeah, it's perfect. I'm definitely going to look into that for some of my own clients too, and to share that. And for anyone that would like some personalized support on your IVF journey, reach out to me at ivfmanifestingamiracle.com, and here to help in any way possible to improve your, you know, your journey experience, have more joy, more peace, more clarity, more confidence as you go about your fertility journey. So thank you so much, Dr. Greene.
Stay happy.
And happy St. Patrick's Day.
Happy every day.
Happy every day. Stay green. Bye.